Hi everybody, welcome to part 3 of Common Pediatric ECGs in the series of Dr. Manny's YouTube Learnshops. These courses are for your paediatric nurses and not paediatric nurses, but those who are interested in monitoring cardiac rhythms, and they will provide you essential fundamentals in relation to paediatric rhythms, arrhythmias and dysrhythmias. And as mentioned previously, they are often associated with congenital heart disease. The learning objectives for this session are that we will review sinus rhythms, supraventricular rhythms and ventricular rhythms, which could include some that are considered life-threatening. Knowledge review, again. Okay, let's review again. Which of the following is the normal pacemaker of the heart? A, B, C or D? The correct answer is A, the SA node. Which of the following are components of the conduction system of the heart? A, B, C or D? The correct answer is D, all of the above. Which of the following statements represents the P wave? A, B, C or D? The correct answer is D, atrial depolarization. Which of the following statements relates to the sympathetic nervous system? A, B, C or D? Absolutely, the answer must be D. Which of the following statements is correct about a normal heart rate? Is it A, B, C or D? The answer must be A, because all the others would be considered to be slow and potentially bradycardic. Which of the following relates to the parasympathetic nervous system? A, B, C or D? And the correct answer is they all relate to the parasympathetic nervous system. Which of the following are standard ECG leads, or certainly pertain to the standard ECG leads? A, B, C or D? And the correct answer is they all pertain to being standard ECG leads. Which of the following relates to sinus tachycardia? Is it A, B, C or D? Well, the answer has to be D. Which of the following connect to atrial fibrillation? Is it chaotic? Does it have a rapid rate? Is it irregular? Does it have no P waves? Therefore, is it all of the above? Yes, it is. It's all of the above. Which of the following correlates to a premature ventricular ectopic complex contraction? A, B, C or D? They all relate to premature ventricular ectopics. Name the following ECG anomaly. Now, you should be able to get these if you've done the previous courses. Absolutely, these are premature ventricular complexes. Couplet. What's the ECG anomaly? Supraventricular tachycardia, SVT. What's this life-threatening rhythm? Ventricular fibrillation, which is very coarse. What about this ECG anomaly? Asystole. What about this one? Irregular. This is atrial fibrillation with a controlled ventricular response. Okay, now let's start reviewing some of the rhythms. Now, these are the common sinus rhythms. You've got sinus rhythm, which can be normal or abnormal. We're only going to be looking at the normal. You've got sinus tachycardia, sinus bradycardia, and sinus arrhythmia. Now, sinus rhythm in the older child more than 3 years of age, this is a regular rhythm at a rate between 60 and 100 beats per minute at rest. And the criteria, which I'm not going to go through, which have been reviewed previously, I'm just going to mention here now that the criteria for age is what the normal Qrs Complex is. regular, rate between 60 and 100 at rest with a normal PQRS complex. Sinus rhythm in the infant or the young child less than 3 years of age, it's a regular rhythm. The rate is between 80 and 100 beats per minute at rest, and the criteria is a normal PQRS complex according to their age group. Then you've got sinus rhythm in the newborn. This is a regular rhythm at a rate between 100 to 150 beats per minute at rest, and the criteria for their age for their normal PQRS complex. Well, what's sinus tachycardia then? Sinus tachycardia just means fast. It's a regular rhythm. The rate is the upper limit of normal for their age, which we said was in the older child more than 100 beats per minute. In the smaller child, less than 3 years of age, more than 120 beats per minute. In the newborn, more than 150. The QRS complex, or the PQRS complex, is according to their age criteria. And this can be associated with crying, pain, fever, fear, hunger, anemia, hypovolemia related to shock, or any distress. Sinus tachycardia in the 3 specific age groups mentioned previously. What's sinus bradycardia then? Well, sinus bradycardia is a slow, regular rhythm at a rate lower than their normal age. In the older child, less than 60. In the transitional child, less than 80. In the newborn, less than 100. But as mentioned previously, remember, tachycardia or bradycardia, you always relate to their clinical symptoms and signs. And this can be associated with sleeping, being an athlete. With athletics, you're parasympathetic dominant. Hypoxia, hypothyroidism, hyperkalemia, hypothermia, intracranial pressure that is elevated, or medication toxicity such as digoxin, beta blockers, calcium channel blockers, or it could be related to genetics. Then you've got sinus arrhythmia. Sinus arrhythmia just means irregular sinus rate. So this is variable. It's an irregular rhythm with a rate between the upper and lower limits for their normal age. It has a normal PQRS complex, and typically it's associated with being physically fit, parasympathetic dominant, sleeping, normal breathing, or it could be related to cardiac surgery. Because during respiration, for example, here, during expiration, the heart rate can slow down because of vagal stimulation. During inspiration, it can stimulate the heart rate to come up because the vagus isn't being stimulated. And this relates to your medulla oblongata in relation to the vagus nerve in particular, which is connected to the SA node and being the intrinsic pacemaker. Perfectly normal. Sinus pause and arrest is another variant. It's an irregular rhythm, and its variable rate depends on the conduction defect, or what you talk to as a block. There are pauses with periods of arrest. The PQRS complex is according to their age criteria, but this can be associated with vagal stimulation, feeding or defecating, sleeping, could be related to toxicity with medications such as digoxin or amiodarone. It could be related to genetic disorders like long QT syndrome, or it could be related to cardiac surgery. Supraventricular dysrhythmias or arrhythmias, they're from the atria, and they're recognisable because they have a different shaped P wave. Common ones are premature atrial complexes or ectopics, or contractions, whatever terminology that you like, or the wandering atrial pacemaker. Premature atrial complexes are just that. They're premature. They're early. They make the rhythm irregular. They've got a different shaped P wave. The Qrs complex is typically more narrow, less than the upper limit of normal for their age. They're associated with physical activity, excitement, normal, caffeine or cigarette smoking, stimulants, structural heart disease, problem, hypoxemia, electrolyte anomalies, certain diseases such as hypothyroidism, and, as we already indicated previously, digoxin toxicity. Typically, they're benign. They're not typically problematic. Wandering atrial pacemaker is another benign variant rhythm. However, it makes the rhythm irregular. It's got different shaped P waves, consistently changing. It's got a narrow Qrs complex that may be less than the upper limit of normal for their age. And it's typically associated with physical activity, being excited, which really comes from sympathetic nervous system stimulation. Benign, not typically a problem. Often referred to as WAP as an acronym. Wandering atrial pacemaker. Then we look at ventricular dysrhythmias. And these dysrhythmias or arrhythmias are from the ventricle. And they have a different shaped Qrs complex. Common ventricular dysrhythmias are premature ventricular complexes. And premature ventricular complexes are premature and again make the rhythm irregular. They are not associated with a P wave and they have a wide Qrs complex that is typically greater than 0.12 seconds. And they're associated with physical activity, excitement, again stimulants such as caffeine or cigarette smoking. They may be related to structural heart disease or problems such as hypoxemia, electrolyte anomalies, which relate to magnesium, potassium, or they could have other disease processes such as hypothyroidism and have digoxin toxicity. Premature ventricular complexes can be unifocal, which means coming from one focus. And if they come from one focus, they have the same shape. However, they can make the rhythm irregular. Sometimes the rhythm can be regular, but I'm not going to discuss that in this section here. It makes the rhythm irregular and they are not associated with a P wave. The Qrs complex is wide, greater than 0.12 seconds. Then you can have multifocal, meaning coming from a number of different focuses. And because they come from a number of different focuses, they can be negative, positive, or biphasic. And again, they make the rhythm irregular and they're not associated with a P wave. The Qrs complex is wide, wider than 0.12 seconds, or wider than 3 small squares. Think of it like that. Then you've got couplet PVCs, which you've seen previously, and these are two conjoined premature early beats. They're the same, or they can have a different shape, but they're together. And because they're together, they're a couple. And it can make the rhythm irregular. There are no associated P waves, and the Qrs complexes are wider than 3 small squares, or 0.12 seconds. Let's revise before we move on. You've got a 3-year-old child complaining of palpitations. What do you think the problem is? Palpitations are heartbeats you can feel. They can be distressing. This is sinus rhythm with couplet PVCs. Then you've got a 10-year-old child who's asleep in an observation ward, for example, just being observed for whatever the reason. What's the rhythm? They're asleep. 10-year-old. This is sinus rhythm. Heart rate's approximately 75 beats per minute. Then you've got a 2-year-old infant receiving bronchodilator therapy for asthma in maybe an emergency department or a clinic. What's the rhythm? Remember your systematic approach. This is sinus rhythm. In a 2-year-old infant, the rate is probably around about 120 beats per minute. Here's a 9-year-old child receiving conscious sedation, sometimes referred to as moderate sedation, sometimes referred to as procedural sedation, in a clinic. What's the problem? Is there a problem? There's a sinus rhythm with unifocal PVCs, premature ventricular complexes. Here's a 4-year-old child asleep in a post-treatment clinic, maybe after dental extraction. Is this normal or is it different? This is sinus arrhythmia, irregular. Inspiration prolonged, expiration faster. Newborn infant in maybe an intermediate care straight after being delivered. This is sinus rhythm. Okay, that's the end of part 3. Now consider moving on to part 4. See you in part 4.